It is a journey that started at 6 a.m. on Saturday in Kisumu County with an aim to run all the way to Mombasa. With every step, James hopes to add to the amount of money he's raising to save a child with a heart condition.
We are looking to raise about 9 million. So that's equivalent to the number of kilometers we are doing. So each kilometer is equivalent to $100. That's like 10K. You know, congenital heart disease is not a cheap thing to treat. We have to do all we can to try raise as much as we can so that all these kids, remember, this is the future. If we don't take care of them, we don't have a future.
This is his fourth day on the road, having covered over 300 kilometers from Kisumu all the way to Maimahiu. At Tenwek Hospital, the reality of the inspiration behind James' race hits us. This week, 8 children under the age of 12 years have undergone heart surgeries. The cost of treatment is approximately 1 million Kenya shillings per child. According to Dr. Aregi, who is a cardiothoracic surgeon, it is a matter of life and death for these children. Even worse, their parents are unable to cover the costs.
Nilikuwa na shimo kwa moyo, nilisaidiwa. Saa hii mtoto ako hai, anaendelea kuwa mzuri.
This pediatric population suffer from this disease. Unless it is fixed, it will cut their life short because the heart defect that they born with, the body tries to manage, to balance and keep them going. But when it is not intervened on right time, the heart completely fails and then they die.
According to the management of Tenwek Hospital, every week, 3 to 5 cases of heart problems are reported in the hospital. Up to now, 700 cases of patients with heart problems have been reported, 200 of those being children.
Fortunately, when they get the surgery done, most of these kids will live a normal life to age of 85 without needing another surgery.
Around 30% of our patients are not able to pay at all, especially as we try our best to help our cardiac patients. We realize that sometimes we have very needy cases that comes to Tenwek. We cannot chase them away. We are doing our best, even as a hospital, to work within those limits that we have in terms of resources.
According to findings by the CDC, approximately 3.5 million children worldwide are suffering from heart conditions, 90% of these cases being from developing countries due to lack of early diagnosis and right medication. This is the story of a young man who has decided to beat all odds and run across 12 counties, 1,000 kilometers, if only to save a child dying of a heart condition. Rahab Kinote, K24 at Tenwek Hospital in Bomet County.